Evolution and development of the contemporary nursing practice. Introduction. The nurse assumes responsibility and acts with proper authority, directly performing professional duties. The nurse has the right to independently assess and decide whether they need to continue their education in management, training, clinic work, and research, and take steps to meet these needs. Nursing includes planning and assisting with illness and rehabilitation and considers the impact of various aspects of a person's life on health, disease, and disability. Thus, nursing is a crucial element of the healthcare system that directly affects public health. Evolution of nursing practice. Like any science, nursing has a history that spans millennia, reflected in the monuments of literature and art. According to evolutionary concepts, medicine of the ancient world included a wide range of the most diverse knowledge. When society reached a sufficiently high level of development and there was a need to care for many sufferers, this noble cause became an integral attribute of those who professed Christianity. Monasteries did a lot for the sick, and therefore monks were often invited to take care of the sick at home. Nursing content has changed over the centuries, just as the demands of society and living conditions have changed. Florence Nightingale is considered the founder of nursing all over the world. In her youth she considered it her mission to rid people of disease. Nightingale's ideas and practical activities helped raise the prestige of the work of nurses, and nursing will take shape as an independent profession. Subsequently, the International Red Cross emerged, which did a lot for the sick and wounded. Thus, the business of nursing the sick and suffering, having passed through different stages of the development of asceticism, has become a profession. The scope of practice and the approach to the treatment of patients have become more advanced and continue to evolve more technologically and modern. The tools used in treating patients have become more meaningful, and the medical approach has become individual and more effective. Features of BSN and ADN practices. High-quality higher education for medical workers helps patients recover faster and reduces mortality. Experts reported a relationship between what degree nurses have received and how high-quality care they provide to patients. Scientists argue that more educated medical staff patients recover faster than junior specialists, and mortality is falling. In addition, the diploma, or hospital program, was a 3-year program that emphasized practical experience. College courses in natural sciences, namely anatomy, physiology, and microbiology, were accepted to universities. Bachelor's degree programs in nursing include the basic educational requirements of a college or university degree program. For example, these are classes in English, mathematics, humanities, and various elective subjects. In addition, at the bachelor's level, a nurse is expected to read, use, distribute, and conduct research. While at the diploma level, they are only expected to read and use research. The university part of the program is designed to provide the broader awareness and critical thinking needed to be a more advanced and thoughtful thinker. ADN nurses are usually focused on clinical tasks and day-to-day care, such as monitoring patients, performing basic procedures, or maintaining documentation. In addition to direct patient care, BSN nurses have the opportunity to take on leadership, administrative, and managerial roles, focusing on the scale of healthcare institutions. For example, in caring for a patient, ADN will not have the necessary additional critical thinking and communication skills to provide him with the required degree of security. BSN, by contrast, is more likely to use evidence-based practice and team problem-solving to minimize the margin of error. Evidence-based nursing practice. To date, evidence-based nursing practice is an actively developing area in nursing, which aims to improve the efficiency and quality of nurses' work. This direction can be successfully integrated with other modern principles of nursing care, such as the nursing diagnosis or the nursing process as a whole. Evidence-based medicine is a new approach, direction, or technology for collecting, analyzing, generalizing, and interpreting scientific information. Evidence-based medicine provides for the conscientious, explicable, and common-sense use of the best modern achievements for each patient's treatment. The RN-BSN nurse's academic training supports its application, as it requires serious training and knowledge based on reliable scientific information. This nursing practice can be represented by the following algorithm of actions, which includes formulating a question, a systematic search for evidence, their integration, decision-making, and evaluation of its results. Collaboration with interdisciplinary teams. The principle of collective work in working groups to improve the quality of medical care is implemented by organizing a creative environment for specialists of various professions and qualifications. The concept of an interdisciplinary approach requires group work of specialists of different professions by attracting knowledge from the relevant fields. The cooperation of nurses with interdisciplinary teams contributes to more effective patient treatment results, since forming an effective quality management system of medical care is impossible without the broad involvement of doctors, nurses, and other specialists. Thus, the medical staff gets the opportunity to react faster and cope more effectively with patients' problems, as interdisciplinary teams involve many specialists. Conclusion. Summarizing all of the above, it is possible to conclude that today nursing is an art, a science that requires understanding and applying special knowledge and skills. The modern idea of the development of nursing in society is to help individuals, families, and groups to develop and maintain their physical, mental, and social potential. ADN and BSN practices adhere to the provisions of evidence-based medicine, forming appropriate requirements. In addition, nurses often collaborate with interdisciplinary teams, improving their skills and reducing the chance of medical error.